ZoNoH as a project has started this particular project or program in Kakamega County because of the rampant cases of outbreaks that are zoonotic related.
Zoonotic diseases, these are diseases that are transmitted from animals to human beings.
One Health basically is about linking the human health, animal health, and they call it the environmental aspects, and seeing how these interact to contribute to disease outbreaks. And it has necessitated the requirement that these three areas or three technical areas work together to make sure that we are able to contain outbreak of diseases, and when there is an outbreak, then find ways of curtailing the spread and stopping more damage caused by the relevant diseases.
And the county has had a challenge with zoonotic diseases that includes anthrax, rabies, trypanosomiasis, and Rift Valley fever. And we realized this is something that can be prevented and can save a lot of deaths. And so through the interventions, the Department of Health is spearheading this intervention, supported by the Department of Agriculture, Veterinary, Livestock, and of course water and environment. And we plan to have quite a number of interventions in all the three sectors.
Therefore, we need to have a very good coordination mechanism between the Ministry of Water and Environment, the Ministry of Agriculture, and the Ministry of Health. That coordination mechanism will enable us come up with common strategies, common policies that we'll use to eradicate or control the diseases, but at the same time to mobilize resources that will eventually use to implement some of these strategies and policies.
My call to action to partners and other donors is that One Health now needs to be treated as a cross-cutting issue, especially in the sectors of environment, health, and food security, so that whenever programming is done, just like climate change, certain resources need to be put in place to support mitigation measures against these outbreaks. And whenever there are outbreaks, there needs to be funds that are able to be activated to contain the damage that some of these zoonotic challenges can cause. In addition to antimicrobial resistance, communities should be made aware on, for example, withdrawal periods once medicines are administered, especially in livestock. Food safety generally, how are food produce handled? Because again, because of the challenges to do with post-harvest handling and processing, we end up having a lot of spoilage, and in the process, some of these are consumed by households, which then turn out to be harmful to their health. Early warning systems to be put in place so that before these outbreaks occur, already the communities can be able to project that an outbreak would occur, and therefore the relevant mitigation measures be put in place.